Revision rhinoplasty is an art form unto itself because we've got an educated patient who's undergone a procedure that they may not like the outcome particularly, and it can be a breathing problem or it can be a visual problem that they see. And it's very critical with these patients to be very explanatory as we're going through this and trying to find out exactly what they're concerned about, and I mean exactly. In most circumstances, we can help them somewhat, but one has to be very realistic in that if they've already had one rhinoplasty, it sometimes can be very difficult to achieve absolute perfection. But in most circumstances, we can improve things somewhat with regards to airway, appearance, symmetry, form, and that's what we want to address in these patients. If we can improve some aspect that is really driving them crazy, that's what we want to do. We see a lot of revision rhinoplasties coming from all over the world. There are great surgeons everywhere in the world, but there's an attitude that people can get a better deal if they go overseas, but then seeing a surgeon in a foreign country, if you have minor issues that can be dealt with readily, it's sort of tough if they're a world away. And so there may be advantages to having surgery done locally. We know what the credentials are of the surgeons who are here, and we're a little bit iffy about some of the credentialing that's been performed in other parts of the world. We tell most patients with thin skin, it's going to take about a year to heal, thick skin maybe 3 or 4 years, but if you've had a revision rhinoplasty or multiple rhinoplasties, it's going to double your time to heal. Why does it take so long to heal? Scar tissue has a funny way of taking its time to heal, smooth out after surgery. And people who've had revision rhinoplasty, we see more of these people requiring elaborate taping jobs to help improve the rapidity of healing. And in some of these cases, we may have to inject a little bit of steroid to smooth out little lumps and bumps, which occur more frequently. So you have to gauge your expectations when we're doing revision rhinoplasty. It takes longer. We may have to fiddle a little bit more. And so you just have to bear in mind it's not going to happen overnight. When we perform revision rhinoplasty, a couple of things to bear in mind. Sometimes we cannot achieve absolute perfection based on what they've done in the past. It takes a long time to heal, and we may have to fiddle during the healing phase to help enhance the final result. And that's a given. The other thing is that when we're performing revision rhinoplasty, we may have to use grafting materials from other parts of the head and neck. Sometimes we may have to go into the nose, take some septal cartilage, go to the ears, take some ear cartilage to put into the nose to reshape and reform the nose. And if you've really had a bad run with previous rhinoplasties, occasionally we might have to harvest a rib graft to help enhance the final result. That's pretty routine when we're doing revision rhinoplasty, and it's something that the realistic patient has to bear in mind, that we may have to go elsewhere in the head and neck to achieve the result that they want to achieve. If you've done your research and you're thinking of having a surgical procedure, call our staff at the Younger Facial Surgery Center and they'll book you in for a consultation and we can weigh your options for potential surgery.